Welcome to Lecto. Today we are going to discuss action potential in cardiac muscles. Let's start. As we know, heart having two nodes, SA node and AV node. And from these nodes, potential travel to different ventricles and atria. In atria, the potential travel through Bachmann bundle, and in ventricle, it travel through bundle of His. Actually, potential start from SA node, and it travel to different muscles of the ventricles and atria. And next here you can see that this is the nodal cell or SA node, and this is the contractile cell from which atria and ventricle form. In both cells, common things are calcium channels, having both of them, sodium channel and potassium channel, and last one is the sodium potassium pump. But there is a little bit different between these two cells. Nodal cells having two types of calcium channel. Here you can see this is the T type calcium channel. Transit, it means it open for a short duration, and here is the L type calcium channel. It means it opens for a long duration, and the nodal cells having both types of calcium channel, and in contractile cell it has only one calcium channel, which is L type calcium channel. So there is a difference between these two cells. Basically, nodal cells are in resting membrane potential, which is minus 60 millivolts. Actually, these values are in millivolts, minus 60 millivolts. How? Actually, there is a sodium potassium pump present over the membrane of the nodal cells, and with the help of the sodium potassium pump, sodium move outward and potassium move inward. Due to their movement, it attain a resting membrane potential, which is minus 60 millivolts. Actually, this at that situation, these are in the polarized state. And after, when the action potential start, sodium channel, which are actually the funny sodium channels, open, and sodium rush into the sodium ions rush into the cell of the nodes, and due to the rushing of the sodium, the membrane potential become less negative. It means in resting membrane potential, actually the membrane potential is negative inside and positive outside, and due to the rushing of the sodium, the membrane potential of the inside of the membrane become less negative. Here you can see, which is shown by the red color, minus 60, and it will move to the, let's suppose, minus 50 millivolts. And after that, calcium channel, which are T type calcium channel, opens, and calcium rush into the cell. It means further reduce in the potential of the membrane, which is less negative, and it will move towards the minus 40. Here you can see minus 40. At resting membrane potential minus 60, after the opening of the sodium, it will become minus 50, and after the opening of the calcium T-type calcium channel, it will move toward the minus 40 millivolts, and after that L-type calcium channel opens and calcium rush into the inside of the cell, and due to the rushing of the calcium ions, it will attain the plus 40 millivolts. It means at that situation the inside potential become positive and outside potential become negative at that situation, and it means there are a lot of positive ions present in the cell of knots, and here you can see some ions like calcium and sodium move towards the contractile cell. This is actually the depolarization. Depolarization. It means the membrane becomes depolarized, and after that this potassium channel opens and potassium rush outward, and due to the rushing of the potassium from inside to the outside, it becomes moving towards the repolarization state. It means at resting membrane potential membrane is polarized, and due to the opening of the different channels and ions move inside, the membrane become depolarized, and after this opening of this potassium channel, the membrane again become repolarized. Here next you see contractile cell. Different ions move into the contractile cell, and due to these cell, which is contractile cell, are actually at resting membrane potential which is minus 85 millivolts. Actually these are in millivolts, and after the rushing of the different positive ions, these the potential will rise towards the minus 70 millivolts, which is actually the threshold. Threshold is actually activate the action potential in the next cell, and after when it will move towards the threshold voltage which is minus 70 millivolts, different channels which is present in the contractile cell activate. First of all, sodium channel activate, and due to the activations of the sodium channel, different sodium ions move inward, and due to the movement of the sodium ions, the potential move rise upward and become plus 20 millivolts. At resting membrane potential, outside membrane is positive and inside membrane potential is negative, and due to the opening of the sodium ions, the potential reverse. It means inside become positive and outside become negative, and this is the opening of the sodium channel, and after that for a small duration potassium channels opens and potassium rush outward, and due to the rushing of the potassium from inside to the outside, the membrane potential will decrease for a small duration. Here you can see which is the shown by the green. It means voltage membrane potential will less positive, and after that sodium potassium channel close and calcium channel which is L-type calcium channel opens. Before we discuss L-type calcium channel, you must remember that there is a tube-like structure. It means these are invagination of the plasma membrane, and several mucopolysaccharides are present over this tube-like structure which is T-tubule, and calcium attached to these mucopolysaccharides. These are actually mucopolysaccharide having negative charge and calcium positive charge, and they bound together. And when they require, calcium detach from the mucopolysaccharide and move inside of the cell. This is an exception case which is present in only the cardiac muscles. Right? So potassium channel closed and calcium channel open, and calcium rush into the cell, and it result in the formation of the plateau. This is actually the duration of the plateau. And when these calciums are used in the cell for contraction. Here you can see when these calciums enter into the cell, they actually, this is the organelle which is sarcoplasmic reticulum. This activate receptor which is ryanodine receptor channel. These open. Actually, calciums are stored in the sarcoplasmic reticulum, and when they activate, different calciums move from the sarcoplasmic reticulum. Calcium move into the cytoplasm of the cell. Here there are a lot of calciums present in the cytoplasm of the contractile cell, and these calciums are used in the contraction of the cells. Here you can see this is the actin and myosin filaments, and these use calcium for the contraction of the cells. Actually, this is the sliding filament model due to which the cell or muscles contract. And after usage of the calcium, they move into the cytoplasm, detached from filaments. And now again there are a lot of calcium ions present into the cytoplasm. Now these calciums move into the sarcoplasmic reticulum through ATP pump. It means ATP is required for the pumping of the calcium from cytoplasm into the sarcoplasmic reticulum. And now different and lot of calciums move outward, which is the sodium calcium exchanger, and different sodium move inward. Calcium move outward and sodium move inward. And now sodium has to be removed by the ATP pump, and now the sodium which entered into the cell move outward again with the sodium potassium pump. And here you can see sodium move outward and potassium will move inward. Right? There are two portions of the calcium. Some amount of the calcium moves sarcoplasmic reticulum, and some amount of the calcium move out of the cell through the calcium sodium exchanger. Here now we have discussed that this is the depolarization, this is the plateau phase, and now the last step, which is the repolarization. Repolarization, it means remaining towards the resting membrane potential. Here for the repolarization, again calcium channel close and potassium channel opens. It results in the again repolarization. It means the potential which is negative outside become positive, and negative become, and the inside of the membrane become negative again, and attain the potential of minus 85 millivolts. So this is the how the action potential occur in the contractile cell. Here a special case, it results in the formation of the plateau. Plateau actually remains 0.2 second for atria and 0.3 second for ventricles. it means atria contract for a short duration and ventricle contract for a long duration. So this is all about the action potential in the cardiac muscle. If you have any question, then you may ask in the comment section. Thank you.